Hi guys, I'm Alicia Wixom and I'm doing my presentation on suicide prevention. Suicide is a serious health problem that can and does have lasting harmful effects on individuals, families, and communities. Most people who attempt suicide want to live, but see death as the only way out. In 2013, the Centers for Disease Control and Prevention also collected data about mortality in the U.S. There were 41,149 suicides reported that year, making suicide the 10th leading cause of death for Americans. It is also very important for people around my age to know about suicide and suicide prevention, because in 2013, the suicides reported made it the second leading cause of death among college campuses. That means that in that year, someone in the country died by suicide every 12.8 minutes. Not only college students are at risk. Risk factors for suicide include a family history of suicide, previous suicide attempts, excessive drug and alcohol use, prolonged depression, financial difficulties, serious illness in oneself or a loved one, and loss of a loved one. Now that I have talked about suicide and the risk factors of suicide, I want to talk about suicide prevention, because suicide can be prevented. Prevention means to hinder something that is happening. Suicide prevention is simple. Reduce factors that increase risk and increase factors that promote resilience. 75 to 85% of people who commit suicide indicate their intentions of doing so. One way to help prevent suicide is by knowing the warning signs. Warning signs include these: recent loss and a seeming inability to let go of grief, a history of depression, change in personality, withdrawal, irritability, anxiety, and tiredness, change in behavior, inability to concentrate, loss of interest in classes or work, unexplained demonstration of happiness following a period of depression, sexual dysfunction or diminished sexual interest, expressions of self-hatred and excessive risk-taking, change in sleep or eating habits or in appearance, a direct statement such as, "I might as well end it all," an indirect statement such as, "You won't have to worry about me anymore." Final preparations such as writing a will or giving away prized possessions, and preoccupation with death. Another way to help prevent suicide is by knowing what to do if someone you know threatens suicide or displays warning signs of doing so. There are crisis counselors and suicide hotlines that may help temporarily, but the best way to prevent suicide is to get rid of things that may precipitate attempts. Things like alcohol, drugs, isolation, and access to guns. If someone you know threatens suicide or displays warning signs of doing so, here are some things to do. Monitor signals. Ensure there is someone around the person as often as possible. Don't leave him or her alone. Take threats seriously. Don't brush them off as just talk. Let the person you know how much you care. Say you're there to help. Listen. Try not to discredit or be shocked by what the person says. Empathize, sympathize, and keep the person talking. Ask directly, are you thinking of hurting or killing yourself? Don't belittle feelings. Don't tell the person he or she doesn't mean it or couldn't commit suicide. To some, such comments offer the challenge of proving you wrong. Help think about alternatives. Offer to go for help along with the person. Call a suicide hotline and use all available community and campus resources. Tell your friend's spouse, partner, parents, siblings, or counselor. Don't keep your suspicions to yourself. Suicide is a serious health problem, but it can be prevented, so don't wait. If you or someone you know are contemplating suicide, then please get help. Call the National Suicide Prevention Lifeline at 1-800-273-8255. That's 1-800-273-TALK. You can also get more information on suicide prevention by visiting www.cdc.gov and the American Foundation for Suicide Prevention at www.afsp.org. I hope you guys know how important suicide prevention is and that we can help others and ourselves if we are really looking for those warning signs and trying our best to help prevent. I hope you guys take this seriously.